Here at South Central Foundation in Anchorage, Alaska, we serve about 45,000 customer owners. We see them in 6 primary care clinics. There's about 250 employees. Each clinic has about 6 doctors or PAs, primary care teams as we call them, that include a case manager and a CMA. In each of these clinics, there are 2 master's level clinicians called behavioral health consultants that are responsible for working collaboratively with these teams.
Hi, Ann.
There's a real emphasis on enhancing the spiritual, mental, emotional, and physical well-being of the customers that are seen here, and SBIRT is one piece of this.
We do the initial screening and the initial brief intervention in primary care. We assess, using the motivational interviewing model, the readiness to change on the part of the individual that we're working with, and make treatment referrals or treatment recommendations based upon that readiness to change.
So the way the SBIRT program works is when a person checks in at the front desk and a PCC Plus is printed out for the provider, on the top it'll say SBIRT now due. So when the CMA sees this, they'll ask the first 5 questions.
We drink 4 drinks monthly. Yeah.
We get really personal with the patient and make them feel comfortable, and from there, when they're comfortable, they're able to answer the questions that are within the questionnaire of the SBIRTs.
My job then is, after the visit is over, if I somehow integrate it in with the visit, I then lead into, I see that we scored a little high on this. I would like to have somebody come in and finish asking the questions. Is that okay?
Once I go in, I'll finish the rest of the question. We talk about standard drinking limits. If they're ready to make a change, we'll do brief intervention, we'll offer resources, and also let them know about the other BHCs here in clinic. If it's negative, it gets scored, and then next year it'll come up again that it's due. So they're due once a year.
Substance abuse screening is not done in isolation. It's done in conjunction with really focusing on that whole person, the context that this substance use is occurring in, and how do we support the whole system and the whole family.
So they've seen a benefit of screening and trying to catch the drug and alcohol problems early and getting them treated, which in the long run helps with all healthcare aspects.
Over the course of time that we've had the SBIRT program, we have seen evolutions. We really are focusing on adolescents now. How can we really get in on the front end and help shift choices people are making?
The sustainability of this program is contingent upon making sure that we maintain that level of commitment on the part of the care team, and that is articulated in as clearly a fashion as possible to the customer owners. I think we've been pretty successful with that.
We had to think well beyond the scope and duration of the grant, in that behavioral health needed to be a core component of every single ambulatory visit that we had.
I was actually the first behavioral health consultant, and now there's 18. So we've continually added, and I believe our SAMHSA grant initially funded 6. And they found that there was such a value in providing this service, and that we were able to reduce ER visits and other utilization and really help people get to the services that they needed to get to. So when the grant ran out, they chose to continue to fund these positions. And so we still bill Medicaid, still bill private insurance, but still get more block grants from Indian Health Service. Some of the challenges that we faced when the grant ran out is sort of shifting from an outside entity, making demands on what you needed to do and not do, and really deciding what fit for our customers and in our clinics. Leadership that finds the service valuable and is willing to work through the kinks and the bugs, hiring the right people to work in a primary care setting, and then measurements, making sure that you're looking at your measurements. Is this really making a difference?
Not only is it possible for you to make this a customer-friendly experience, it's also possible for you to make this a more cost-effective experience. You want to make sure that you build it at every tier as lean as possible. The thicker you build it, the more difficult it is to perform, the less likely you're going to keep doing it after your funding runs out.
Some advice I'd have for implementing the SBIRT program would be to pilot it with 1 or 2 of the providers within an agency and work out the kinks, and then have those providers go back and educate the other staff on how to roll it out. You know, what they found helpful to normalizing it for the patients, how to introduce the behavioral health consultants into their primary care team.
So my best advice is to make a personal connection with the patient so that they're more willing to open up and connect with you and answer these questions, and just to reassure them that this is something that we are doing as a screening just to help them to better fit their needs.
You need to make sure that you have the resources available to help a patient when issues come up, or if they score positive or they want the intervention. You really need to make sure that you have the resources to be able to help somebody when they're ready for that help.
We really want to see the whole person and have them experience this as a routine part of their health care. And we just see it as a very important part of prevention and overall health care.